Okay, so look at another nerve injury, and this is what is known as a what? The tardy ulnar palsy. Okay, tardy ulnar palsy. So for the tardy ulnar palsy, we get to look at what it is and what it means. So this is how somebody having a tardy ulnar palsy, this is how their hands will look like. So let's look at the next image. Probably should help us, right? So this is the ulnar nerve. I could see that it runs superficially, so there's now risks of it getting injured. Okay, and the rest of it, So let's look at it. The tardy ulnar palsy, so that is a delayed onset neuropathy of the ulnar nerve at the elbow, and usually takes years, do you understand, for it to even show off. For the problem to actually, start giving you a lot of issues. So the term tardy just refers to the fact that it takes a long time before the symptoms appear. So it's a progressive ulnar neuropathy. So it's usually caused by mechanical compression or stretching of the ulnar nerve at the elbow. So it typically appears years after childhood elbow trauma. So these individuals, if you are taking a history, you mostly get to see that, okay, during their childhood they had an issues at the elbow joint, but it didn't actually show up immediately. So causes could be old, elbow injuries, like all those malunited lateral condyle fractures, malunited supracondyles. Okay. Cubitus valgus deformity, compression, chronic compression. Alright, so motor symptoms are those weakness of the intrinsic muscles of the hand, and you actually have the clawing of the ring and the little fingers. Therefore, sensory issues, there's numbness, okay, because you're not able to feel that much there again. So diagnosis of those clinical examination, electromyography and x-ray of the elbow. So treatment is probably the person needs to rest that part of the body, splint and physiotherapy, and surgically they might actually want to decompress the nerve if it is compressed anywhere.